Okay, thank you very much for joining us for our very important tip for this week. The whole focus of this is who should use BrainSpan. We have a lot of doctors when they first, especially when they first join, kind of they let the kids sit on the shelf a little bit. They know a little bit about it, but they're not sure who should use it. Well, this will answer that question. BrainSpan is about creating healthy cells, right? We all need healthy cells in both our brain and our body. And omega 3, EPA, DHA, omega 6 fatty acids, these are essential fatty acids because they basically balance the needed inflammation in our body. Too much or too little of one will create an imbalance and it'll cause dysfunction in the entire cell membrane, brain, and all the other organs in the body. So everyone needs that. So it's really just about messaging the reason for brain span according to the age demographic that you're seeing at the time. So you can see here examples of academic performance, sports performance, executive, general health and wellness, and then aging. Just a quick word about health and wellness. We know that improving our fatty acid profiles helps people lose weight. We know that because that impacts the mitochondrial function. It helps the cells actually utilize energy more efficiently. So, and then on the performance side, that's a lot of it is lowering the inflammation in the brain and the body. People feel better, their brain works better, and so when we fix these, it's not just about the long-term chronic disease reduction. Yes, that is critical, but it's also about the here and now. And so wrapping it around how it impacts the health of their brain as well as their body today and in the future will allow you to use this test for each and every patient, every annual exam, every initial visit as a very powerful, complete, comprehensive health and wellness tool. But again, don't forget, sure, we've got a whole list of clinical conditions that we know inflammation is at the heart and soul of these chronic diseases. And when we fix the fatty acid profiles, we improve the cell inflammatory state, and that will improve and lower that inflammation that is driving the major leading causes of morbidity and mortality. So, of course, every patient, because we're all at risk of these, needs to have this for disease reduction, but it is important, as I mentioned, for functional status today. So, these are the bottom line tips as I leave you. Don't let it sit on the shelf as a specialty item. Integrate it into every visit as a baseline, fundamental, critical assessment to their core wellness. And patients are going to love you for it. They're going to get this huge report, all the recommendations. Don't worry about like driving revenue off the test. We have most of our really successful docs just integrate it into a visit. There's a charge for that visit. Maybe it's a nutritional consultation, maybe it's an annual exam, but the report will drive utilization and value of other services like nutrition in your practice. That's the best way to use it, okay? Let us help you if you're having trouble with that, because that's what the successful doctors do, and we want you to be successful. If you have questions, email us there. You can email me as well. And if you don't have, we have these special forms for some of those clinical conditions I had up on the screen that'll help you apply it and help the patient understand why. It's got all the information on there. Those are great. Email us. We'll send you out a free stack of those. But we're here to help make it successful. Do not let this be a specialty. Look at this as the most important blood, way more important than knowing a cholesterol panel. And it's for all ages because it's the core of what it means to have a healthy body and a healthy brain, and that is healthy cells. Thank you very much and have a great day.